Thank you.
Thank you for joining us, Dr. Tedros. And many thanks to all our colleagues here for joining us from different countries around the world. Um, Thank you for connecting. We have more than 125 people connected online. I'd now like to turn over to Dr. Teresa Kaseva, Director of WHO's Global Program on Tuberculosis and Lung Health. She is the moderator for today's World TB Day talk show. Over to you, Teresa.
Thank you very much, Monica. Good morning, good afternoon, dear colleagues, distinguished partners and friends. It's great pleasure to host you all today, those online and here in person. And we have excellent lineup of speakers. We have Director General with us, our unwavering leader and the champion in the fight against tuberculosis. We have high-level participants, and without further delays, I would like to greet you and to welcome to this special online talk show to commemorate World TB Day. We do so with purpose, urgency, and solidarity. We stand with millions of people around the world who are still, unfortunately, living with tuberculosis, and we remember and honor those who have tragically lost their lives to this top infectious killer. We, of course, salute the unwavering courage and commitments of all those on the front line who continue to push forward the TB fight despite immense challenges and recent severe funding shortfalls. So we have a very packed but very inspiring agenda ahead of us today. We will have Q&A session. I know that you've been already doing some online exercises and sharing your ideas. So we hope that it will be indeed very interactive. To start this one of these kind talk show, I'm very honored to welcome Dr. Tedros Adhanom Ghebreyesus, Director General of World Health Organization, who will open the talk show with his address. Dr. Tedros, thank you very much for joining us, and thank you for sharing your thoughts.
Thank you, Teresa. Apologies, I'm late, and I really apologize for that. Your Excellency, Ambassador Chen Xu, Honorable Ministers, Mr. John Green, Ms. Yuliia Kalancha, dear colleagues and friends. Thank you all for joining us today, and thank you, Ambassador, for being here on behalf of Her Excellency Professor Peng Liyuan, WHO Goodwill Ambassador for TB and HIV, and we look forward to hearing you deliver a statement on her behalf. Every day, almost 3,500 people lose their lives to TB, and nearly 30,000 people fall ill with this preventable and curable disease. Beyond the death and disease it causes, TB inflicts severe social and economic consequences. On World Tuberculosis Day, we pay tribute to those who have lost their lives to TB and stand in solidarity with those who today live with and fight against it. We extend our deepest appreciation to the health workers, communities, civil society advocates, national programs, and partners for their dedication to ending TB. WHO is committed to supporting countries as they work towards the end TB targets and to providing universal access to life-saving prevention and care. Over the past 20 years, we have made huge gains against TB, saving an estimated 79 million lives from TB. This is thanks to all of your collective efforts. But of course, we still have a mountain to climb to expand services for prevention, care, and research. At the UN General Assembly, just 18 months ago, world leaders made concrete commitments with measurable targets to end TB. WHO is committed to working with all donors, partners, and affected countries to support countries to honor those commitments and meet those targets. The theme for World TB Day this year is, yes, we can end TB. Commit, invest, deliver. Let me highlight 4 priorities as we move forward together. First, we must hold leaders to the commitments they have made and the concrete measurable targets they have set. Second, we must mobilize strategic investment to expand access to TB care and advance research. Third, we must rapidly accelerate the adoption of WHO recommended interventions. And fourth, we must mount a coordinated multi-sectoral response to address the key drivers of TB: poverty, inequity, undernutrition, comorbidities, stigma, and discrimination. Thank you all for your continuing commitment to the fight against TB. As you know, we're facing a difficult financial environment globally, but WHO's commitment remains unchanged. We're leading efforts to accelerate TB vaccine development through the TB Vaccine Accelerator Council, but progress remains at risk without urgent financial commitments. We're also continuing to work with the WHO Civil Society Taskforce to hear and amplify the voices of affected communities and integrate their needs in our work. We will continue to provide global leadership for the TB response, working in close collaboration with partners until Yes We Can becomes Yes We Did. I thank you, and Teresa, back to you.
Thank you very much, Dr. Tedros, for your inspiring words and opening of this online talk show. We appreciate really your leadership, and it means a lot for all TB community. Thank you. It's now my great pleasure to introduce Honorable Mr. Chen Xu, Ambassador Extraordinary and Plenipotentiary Permanent Representative of China, who will share with us the keynote statement on behalf of Her Excellency Professor Peng Liyuan, First Lady of the People's Republic of China and WHO Goodwill Ambassador for Tuberculosis and HIV/AIDS. We would like to request the audience online to press the interpretation button to listen to the address in English, as this is being simultaneously translated. Please, floor is yours.
谢谢 Teresa。我谨宣读彭丽媛教授向本次会议发表的书面致辞，全文如下：尊敬的谭德赛总干事、女士们、先生们、朋友们，大家好。今天是第30个世界防治结核病日。世界卫生组织召开这次视频会议，聚焦承诺、投入、行动的主题开展讨论，对于广泛凝聚各方的力量，共同应对结核病公共卫生挑战，向着终结结核病的目标扎实迈进，具有重要意义。结核病是严重危害人类健康的重大传染病，在世界卫生组织有力推动和国际社会的长期努力下，全球结核病防治成效显著，自2000年以来，成功挽救了7900万患者的生命，这是令人赞叹的成就。作为世界卫生组织结核病和艾滋病防治亲善大使，我谨向致力于结核病防治的各国各界人士致以崇高的敬意。参与结核病防治工作10多年来，我走访了中国和其他国家许多医疗机构、学校、社区，同大家一道见证了全球，特别是中国结核病防治工作的发展进步。中国政府高度重视结核病防治，将其纳入健康中国战略，制定全国防治规划，持续优化防治举措，大力提升防治水平。 中国致力于推动结核病防治技术快速发展，让以患者为中心的支持治疗更加科学可行。经过广大结核病防治工作者的不懈努力，中国结核病患者治愈率保持在90%以上。大爱无疆，大道无垠。中国有超过100万志愿者热心投身结核病防治宣传，他们来自各行各业，有的是大学生，有的是社区义工，有的是中学的校医，还有的自身就是结核病康复者。他们像春风播撒的蒲公英种子，在各地生根发芽，用汗水和真诚给更多人带去防治知识和关心关爱。正是全社会的广泛参与和志愿者的倾情奉献，为中国结核病患者带来信心和希望。消除结核病威胁是我们的共同心愿。当前，结核病防治仍然面临诸多困难和挑战，终结结核病流行任重道远，需要国际社会一道努力，进一步加大投入，采取积极行动。我愿同大家携手同行，积极参与结核病防治工作，用爱心守护健康，用真情传递温暖，为推动构建人类卫生健康共同体贡献力量。预祝本次会议取得圆满成功。谢谢大家。世界卫生组织结核病和艾滋病防治亲善大使彭丽媛，2025年3月24日于北京。宣读完毕，谢谢大家。
Our deepest thanks to Her Excellency Professor Peng Liyuan, First Lady of the People's Republic of China and WHO Goodwill Ambassador for Tuberculosis and HIV/AIDS, for her strong voice and engagement that has contributed immensely to ensuring a high-level spotlight on ending tuberculosis and in mobilizing countries to accelerate their TB response. Our thanks to Ambassador Chen Xu for joining us in person to deliver the statement. We are honored. Dear colleagues, we have, as I've told, excellent line of speakers and very special, many special guests, and it's an honor to welcome our next speaker today, Mr. John Green. John is a #1 New York Times best-selling and award-winning author and YouTuber known around the world for his powerful storytelling in books like The Fault in Our Stars, Turtles All the Way Down. But beyond his literary achievements, John is a passionate and fearless advocate for global health and a dedicated anti-TB champion. His voice has brought urgent attention to the injustices surrounding tuberculosis, and most recently through his powerful new book, Everything is Tuberculosis. And we are pleased to have John, you here today with us. Please share with us your statement.
Thank you so much, and thank you to everyone for being here today. And it's always a joy and a comfort to be with people who care about, who care about tuberculosis, because so often it feels like a neglected disease, even though it's a disease that is responsible for more deaths than any other infection in our world. You know, tuberculosis is listed in the Guinness Book of World Records as our oldest infectious disease. It may have been infecting humans since before we existed, since 3 million years ago. And I think of the long history of tuberculosis as a staircase. You know, we've talked about how we've saved 79 million lives in the last 20 years, which I think is one of the greatest achievements in human history. Unfortunately, we also know that the 1.25 or more million people who will die of tuberculosis this year will die needlessly because we have a cure for tuberculosis. We just haven't done a good enough job of distributing that cure to the people who need it most. So I think of this long story as a staircase. It starts out hundreds of thousands of years ago with no power whatsoever to confront tuberculosis. You know, as recently as 2100 years ago, the Greek doctor Hippocrates told his students not even to bother trying to treat tuberculosis because it would make them look like bad healers. But we kept walking up the staircase. We learned more about tuberculosis. In ancient China and India, we understood the disease to be infectious, which helped with infection controls. And so they saw lower rates of TB than folks in Europe did. We kept walking up the staircase. And then in 1882, we discovered that tuberculosis was definitely infectious and discovered the agent that causes the infection. We kept walking up the staircase, and we developed the BCG vaccine. And then in the 1940s and 50s, we finally developed curative treatment for tuberculosis, allowing people who were on their deathbeds to stand up and walk out of their sanatoria and live long and healthy lives. And we kept walking up the staircase with better diagnostic tools, with better treatments, with shorter course treatments. And that is really the glory of what the WHO has done, the glory of what people fighting tuberculosis have done in their communities. And I think we should credit ourselves for walking so far up that staircase. But it is also true that in the last few months, we have walked down the staircase. And we have done that through shortfalls in funding, through and through failing to get resources to the places where they're most needed. In some cases, taking resources that have already been paid for and just don't have anybody to distribute them. It's absolutely devastating, and I want to acknowledge that. That said, it's easy to feel, I know, and I feel this too, that this is the end of the story, right? Because today is the most recent day we've all lived through. So I inevitably see my life as a story that begins at birth and ends today, because I don't know what the future holds. But today is not the end of the story. Today is the middle of the story of tuberculosis, and it falls to us to fight for a better end together. And I believe that we can do that. I really do, or I wouldn't be here. There has been so much devastation and so much loss, even in the last few weeks, and we know that we'll see a rise in drug-resistant tuberculosis, which is devastating on an individual level, but also on a societal level, because it means more drug-resistant tuberculosis circulating in our communities. But when you fall down a staircase, what do? You know, all you can do is pick yourself up and start walking up the staircase again. And that's the work that falls to us, is to pick ourselves up and walk up the staircase as best we can. We need to marshal all available resources to fight tuberculosis. We need the support of everyone in this room, but also the millions of people fighting tuberculosis around the world. But we also need to be supporting them. We also need to be caring for them, because the people who are on the ground doing the real work are the people who most deserve and need our support. So I'm very grateful to be with you today. Very happy, and always happy to be fighting tuberculosis in community. That's where I find meaning, and I know for many of you that's where you find meaning. So I'm grateful to be with you, and I believe that together we can end TB, but we need to pick ourselves up and start walking up the staircase again. Thank you.
John, thank you very much. We are truly grateful to have you today with us. We know that you are in very hectic book tour right now, and we appreciate your time that you managed to join us. And it's extremely important to have people like you with strong voices to protect the poorest, the most vulnerable people in the world with tuberculosis. You bring us a lot of hope, and I would encourage everyone to read your new book and also share the information to others. Thank you very much. This is extremely important for all TB community. And thank you. And I am now pleased to invite Mrs. Yuliia Kalancha, another strong voice, a representative of WHO Civil Society Taskforce on TB, or to speak on behalf of the civil society and affected communities from around the world. And as well, she is head of the TB Europe Coalition, and she would like to share her messages with all of us. Yuliia, floor is yours.
Dear Teresa, thank you so much. Esteemed colleagues, distinguished participants, As a member of Civil Society Taskforce on TB, I'm honored to speak on behalf of our group and more broadly on behalf of civil society and TB-affected community. And I would like to thank WHO for its continued commitment to supporting civil society and TB community in the global TB response. And we really value WHO's leadership, especially during this time of global uncertainty. And we reaffirm our solidarity as a partners working together to end TB. And as Dr. Tedros mentioned, we are now 18 months past the UNHLM on TB, where world leaders committed to mobilize at least 2,000 billion annually by 2026 to close the yawning TB funding gap. But current level of investment fall dangerously short, and this shortfall is not just an abstract budget concern. It has a human face, and it translates into missing diagnosis, interrupted treatment, and reversed progress. And the impact of the funding crisis is already visible, as highlighted in the recent report prepared by Stop TB Partnership. For example, in Cambodia, due to the sudden withdrawal of US support, TB screening activities were halted across half of the country. The result, 100,000 people were not screened, 300 people with drug TB resistant, and 10,000 drug sensitive TB were missed, and 10,000 people who should have started preventive therapy never did. Additionally, 2,500 contact screening were canceled. In Tanzania, for example, procurement of more than 167,000 gene expert cartridges worth 1.3 million was stopped. And without an alternative funding source, this risk created severe, dangerous shortages. For example, in Ukraine, the future of TB medicines procurement is uncertain for 2026. The country relied heavily on US aid to fill domestic gaps. And the same is true, for example, for Democratic Republic of Congo and many other countries globally. This example highlights the fragility of our progress and the urgency of securing sustainable funding. If we fail to act, millions more will be left behind, and the cost of inaction will be counted in lives lost, communities devastated, and decades of progress undone. So what must be done? First, government must lead. Many countries still rely on external aid for 70–80% of their TB budgets, and this is neither sustainable nor resilient in time of crisis. And national governments must step up by increasing domestic allocation for TB and embedded in TB services into universal health coverage, national benefit packages, and broader social protection system. This is essential not only for closing the funding gap, but also for supporting sustainable, cost-effective solutions that ensure TB services are fully integrated into health and social system. In TB high-burden countries, community-based services and prevention programs are being scaled back due to financial uncertainty. Civil society organizations and community networks, which have been instrumental in early detection, patient support, and advocacy, are at risk of disappearing at all. We call on national governments to embed social contracting for TB community support services, recognize civil society as part of national TB response measure, and include civil society in budget planning. Countries that invested in civil society support service delivery models have seen increased service reach and better outcomes among vulnerable population. Second, international organizations, of course, including WHO, must continue promoting sustainable and inclusive financial models. This includes promoting structured support for civil society engagement. When WHO raises its voice at different levels for inclusive partnership, it opens the door for communities to contribute meaningfully. We see WHO not as a technical leader, but as a trusted ally in raising the profile of community voices, ensuring our participation in WHO and TB reviews, policy planning, implementation processes as well. And TB elimination cannot be achieved by ministries alone. It requires a whole society approach. And in this context, the joint statement issued by the WHO Director General and the Civil Society Task Force is a response to the unfolding financial crisis and a collective call for action. And as the current funding landscape does not match the urgency of this crisis, securing TB finances is not just about meeting the financial targets, it's about ensuring that people with TB receive the care they need when they need it. So the third, donors must protect and expand their commitment. We acknowledge the critical role of Global Fund, UNITAID, so bilateral donors and others. But with shift donor priorities, TB risks becoming sidelined. This cannot happen. TB is still the world's deadliest infection disease. Donors must commit, not reduce their support to TB. Fourth, the private sector must take responsibility. Pharmaceutical companies and diagnostic manufacturers must lower prices and remove patent barriers that hinder access. Reduce costs allow governments to reallocate savings toward broader TB care, especially community-led support, which is cost-effective and person-centered. And corporate social responsibility must move from branding to meaningful participation. And fifth, civil society must remain central, not peripheral, to the TB response. Civil society are not simply implementers. We are drivers of innovation, accountability, and equity. But to play this role, we need consistent institutional support, not just project-based funding, but long-term partnership that recognize the value of the grassroots engagement. And our message today to all actors is clear: nothing for us without us. We cannot afford to continue making promises without plans to deliver them. Let me be clear. The global health security can't also wait. Every $1 billion missing from TB funding results in millions of people going undiagnosed and untreated, tens of thousands of preventable TB deaths, and setback that will take years, if not decades, to reverse. Thus, we urge government to deliver on their financial commitment. We urge donors to step up, not step back. We urge global partners to champion inclusive and innovative funding mechanisms. And we urge private sector to lower access barrier. And we, as civil society, we pledge to continue advocating, innovating, and delivering. And let us ensure that 2025 is not another year of broken promises, but a turning point. And together we can end TB. Thank you.
Thank you very much, dear Yuliia, to you and to all civil society task force and TB community in general. You've been very clear, strong, and I am sure heard by the audience beyond this room. We have, by the way, more than 150 participants, and numbers are growing, and this was very powerful message. Now, dear colleagues, with your permission, we are moving to our panel, high-level panel, which brings together health ministers, WHO, regional directors, global leaders to spotlight bold national, regional, and global efforts to fast-track progress on tuberculosis. And I would like to give floor to the first speaker, His Excellency Dr. Thomas Stephan, State Secretary, Ministry of Health, Germany. So we would like to hear from Honorable Representative of Germany about their efforts to advance access to TB medicines and to address antimicrobial resistance. Dr. Stephan, the floor is yours.
Dear Director General, dear colleagues, many thanks for the invitation. And it's great to be aligned on tuberculosis with so many experts today. And being a representative of a ministry, I would like to join the approach that we just heard, that ministries alone cannot end tuberculosis, but we need a whole of society approach, which is very, very important. And I'm saying that against the background that we all know very well, that after the COVID-19 pandemic, tuberculosis once again tops the list of the world's deadliest infectious diseases, unfortunately. This pathogen, as we all know, was discovered here in Berlin almost 150 years ago by a well-known man called Robert Koch. More than 1 million people worldwide still die of tuberculosis every year. This is far too high a number for a disease that is actually treatable. Every single person who still dies from tuberculosis today is one too many. I'm very convinced about that. Drug-resistant tuberculosis, in particular, is a significant threat to public health worldwide. It is also a global health security concern since infectious diseases recognize no walls or borders. Global challenges such as the fight against and eradication of tuberculosis can only be mastered together. It is therefore important that we facilitate universal access to prevention, diagnosis, treatment, and care. This even applies to low incidence countries aiming to eradicate tuberculosis, such as my own home country, Germany. In Germany, those primarily affected are members of vulnerable and often marginalized groups. These include, above all, homeless people, people who use drugs, people with HIV, or asylum seekers. The social medical perspective is therefore of key significance in our fight against tuberculosis. Germany continues to align its tuberculosis policies and practices, of course, with the latest WHO recommendations. However, challenges remain across the European Union, in particular regarding the availability and high cost of medicines to treat drug-resistant tuberculosis. This emphasizes the urgent need for action to ensure the availability and accessibility of life-saving treatments that are effective, safe, and patient-friendly. Last year, 2 key WHO Europe meetings were held to support this important goal. We are proud to have organized the first conference together with the WHO in June 2024 in the Robert Koch hometown of Berlin. Both meetings were very useful for better national coordination. Establishing a national working group has also helped us to ensure access to the treatments recommended by the WHO. We thank the WHO Europe for placing this topic on its agenda and for supporting the European and the EU countries. In these times, it is imperative to emphasize the essential role of the WHO in international cooperation. This is a very important point for me and for my minister, of course, as well. For the German government, for the current government, as well as for the future government, it is clear that we need more cooperation, not less. And let me add, hopefully together with the United States on board. We affirm our unwavering commitment to WHO as the cornerstone of global health governance and an indispensable pillar of multilateralism. As advocates for multilateralism, we will continue to support WHO financially, technically, politically. One of our most important shared goals remains to eradicate tuberculosis as quickly as possible and to make the world a healthier place to be. And I may add, yes, we can. Thank you.
Thank you very much, Your Excellency, for your positive and constructive approach for the acknowledgement of multilateralism and the role of WHO in particular. It means a lot, and thank you for leading the efforts again to address TB and multi-drug resistant TB in the region. So now we would like to move to another special guest, our regional director for WHO Regional Office for Europe, Dr. Hans Kluge. You see that Dr. Hans is on his way. but his passion and dedication to TB is really amazing. Keeping focus on TB in his very first years in his health career, global health career. He was the champion for many years, doing work at the country level, global level, regional level. Dr. Hans, please share your thoughts. We know that you are doing a lot in these very challenging circumstances. And so what do you think we should strengthen and prioritize?
Thank you so much, Dr. Teresa, and so nice to see my big brother, Dr. Tedros, also Dr. Thomas Steffen, Yuliia from civil society. So I would like to highlight 3 points. The first one in our European region is the importance to shift to outpatient services, to move services from hospitals to community to the primary healthcare. Already we see a significant reduction in unnecessary hospitalizations. It decreases stigma and discrimination. And let's not forget that hospitals often are also a focus of transmission. So number one. Number two, to revolutionize TB diagnosis and treatment. I remember as a TB controller, the 2-year treatment regimens for multi-drug resistant tuberculosis with very painful injections. Now we have a 6-month treatment regimen, fully oral for MDR-TB, with results of about 83% treatment success rate, much higher than the 61% with the traditional regimens in our region. The same for diagnosis. 78% of new TB cases in our region are diagnosed by disruptive innovations. And finally, number 3, to make much better use of artificial intelligence that we're taking forward, be it to improve accuracy of screening or diagnosis with chest tomography. But of course, the big one remains TB vaccines. We desperately need a TB vaccine. Finally, my dear friends, I'm calling for unity, as our WHO Director General, Dr. Tedros, always says. We need to stand together in these challenging times. You're right, Dr. Teresa. I am going to continue to prioritize TB control, because TB control has to do with a lot of social terms of health, with humanity. And thank you to you, to colleagues, also to Lushika, for joining us 7 and 8 April in Astana, Kazakhstan, where we will launch Tuberculosis-Free Central Asia initiative with a lot of determination and participation of BRICS countries. I wish us good luck. Let's not forget that we have done a lot of work, but much more needs to be done. Thank you and see you.
Thank you very much, Dr. Hans. And indeed, I'm looking forward to see you quite soon to launch together this great initiative of TB-free Central Asia. And you are so right that we, despite of the challenges, we have much better opportunities, and even looking forward for having new TB vaccines in the coming years. So that's why we should not have much reasons for pessimism, and should be focused on our work and to make difference for the lives of people with the tuberculosis. Thank you very much, Dr. Hans. And now we are honored to listen to the address of His Excellency Abdullah Nazim Ibrahim, Honorable Minister of Health, Maldives. The country is leading efforts in the Southeast Asia region on TB elimination. Yes, it's possible also to eliminate TB, and TB is airborne disease, and not only high burden countries, but low burden countries are facing TB. It doesn't know borders, but it's possible to eliminate TB. Let us hear from the Honorable Minister.
Bismillahir Rahmanir Rahim. Distinguished guests, ladies and gentlemen, Assalamu alaikum and good afternoon. Today, on World TB Day, we come together to reaffirm our dedication to combating tuberculosis in the Maldives and to eradicating the global TB epidemic. This moment gives us a chance to celebrate the significant strides we have made over the years while also acknowledging the ongoing challenges that still stand in our way. In the Republic of Maldives, we have always understood the importance of a strong and proactive public health strategy. Our unwavering dedication has allowed us to stand as a role model in combating TB, successfully maintaining our status as a low prevalence country for all forms of TB. This achievement is a testament to the hard work, dedication, and collaborative spirit of our healthcare professionals, our communities, and the proactive policies implemented over the years. I am particularly proud to point out that the Maldives is one of just 5 countries worldwide that has met some of the global targets for TB case detection and treatment. This success speaks volumes about the effectiveness of our national strategies and the resilience of our healthcare system in identifying and caring for TB patients. The government of Maldives is deeply committed to ending TB, as evidenced by its inclusion as a priority in the National Recovery and Resilience Plan. We recognize that a healthy population is essential for a nation's overall well-being and sustainable development. Inspired by this vision, we have crafted the National Strategic Plan for 2023 to 2027 with a clear and determined goal to eliminate TB in the Maldives by 2030. This plan outlines our strategies and targets for prevention, diagnosis, and treatment of all forms of TB. As part of this ambitious initiative, we have set out to achieve a remarkable milestone, making 100 islands TB-free. Our initial target is declaring 100 islands free of TB. Guiding documentation and the groundwork for this initiative have been successfully completed. I want to reassure you that the government is fully committed in investing in TB prevention and treatment programs. We are dedicated to making sure everyone living in our country has fair access to care. Our commitment extends to ensuring equitable access to care for everyone residing within our borders. All patients diagnosed with TB in the Maldives are provided with free treatment and are closely monitored regardless of their nationality or immigration status. We firmly believe that access to quality health care is a fundamental human right, and we will not allow any barriers to stand in the way of effective TB care. As we are continuously striving to enhance our capabilities, significant efforts are being made to increase our diagnostic capacity, ensuring timely and accurate identification of TB cases. Furthermore, recognizing the importance of preventative measures, latent TB treatment is also readily available in the country, helping to prevent the progression of the disease and further reduce its transmission. While we celebrate our achievements, we also recognize the unique challenges faced by low-burden countries with dispersed and challenging geographies like Maldives. While the numbers of TB cases may be relatively small, the complexity of reaching every community, ensuring consistent access to services, and maintaining cohesion remains significant. Therefore, on World TB Day, the Maldives calls for intensified attention and tailored support for the global community towards countries like ours. Our case numbers may be small, but the complexities we deal with are significant. Our challenges may be unique, but our determination to end TB remains strong. Ending TB in the Maldives is within reach. Focused investment now will make this a reality. Let's keep working together, reaffirming our responsibilities, leveraging our strengths tackling our challenges, and building partnership to achieve our goal of a TB-free Maldives, while prioritizing health and wellness for everyone.
We thank His Excellency Minister of Health of Maldives for his strong commitment and very comprehensive measures in place, addressing all aspects, including TB prevention, preventive treatment, and social protection measures. Indeed, TB is a very complex disease, but it could be considered as a fundamental for the building a comprehensive health system, strong health system, and that's why you've paid attention that Global TB Program also expanded its mandate. Now we are called Global Program on Tuberculosis and Lung Health, showing a stronger focus on TB, but at the same time fundamental role of TB response that can help address not only TB but other lung health issues and diseases. So with this, I would like now to move to the high TB burden country, to one of the highest, top 30 highest TB burden countries, to Pakistan. We are now pleased to share the address of His Excellency Dr. Malik Mukhtar Ahmad Bharat, Honorable Minister of State for Health, Pakistan. We would like to learn from Pakistan about the progress made in the country and ways forward. Let us hear.
It is an honor to join this forum today and share Pakistan's progress and ongoing challenges in our collective effort to end tuberculosis. As a high-burden TB country, Pakistan is committed to the 2023 UN high-level meetings on TB. We reaffirm our dedication to the political declaration made at the meeting and remain resolute in our efforts to eliminate TB as a public health threat, despite setbacks caused by the COVID-19 pandemic, which disrupted access to TB services and treatment coverage. Pakistan has made significant stride in improving TB notifications. Since 2015, we have provided diagnostics and treatment services to 3.7 million individuals affected by tuberculosis. In line with the WHO recommendations, we have scaled up the use of rapid molecular diagnostics with over 530 expert MTB RIF sites across the country, enhancing our ability to diagnose tuberculosis accurately and efficiently. Furthermore, we have updated our national TB guidelines to ensure alignment with the latest WHO guidelines, reflecting the most effective and evidence-based practices. As we have actively engaged the private sector, including general practitioners, non-government organizations, and large private hospitals. The private sector now accounts for more than 40% of the national TB notifications, demonstrating the importance of a collaborative, multi-sectoral approach. We have also prioritized the decentralization of TB services, including drug-resistant TB services to the district level. This is part of our broader commitment to making TB care more accessible to all. Additionally, we have initiated tuberculosis preventive treatment and are leveraging data to drive decision-making through the District Health Information System DHIS2, which enables real-time monitoring and analysis of tuberculosis data at the national level. Universal health coverage remains a cornerstone of Pakistan's health policy and is central to the Sustainable Development Goals. With support from provincial governments, we have implemented and expanded the universal health coverage program even within the complex public health landscape that we face today. Our TB strategic planning has been further strengthened through the WHO Prime initiative, which has enabled us to develop a comprehensive action plan for multi-sectoral engagement. This approach ensures that all sectors of society are involved in the fight against tuberculosis, fostering a more inclusive and sustainable response. However, bold actions are required to achieve the SDG target by ending tuberculosis by 2030. While we have made considerable progress, recent global fiscal policy shifts have posed additional challenges to our efforts. As a member of the international community, we are working to mitigate these challenges with the support of our donors and partners. Sustainable domestic financing remains a priority, and we are actively collaborating with provincial governments to address gaps and strengthen our TB responses at the local level. On this World TB Day, I reaffirm on behalf of the Government of Pakistan our unwavering commitment to ending tuberculosis. I would like to express our sincere gratitude to the World Health Organization for their invaluable technical support and to all our development partners for their continued collaboration in our joint efforts to make Pakistan tuberculosis free. Together with sustained commitment and actions, we will achieve a world free of TB, inshallah, and thank you very much.
We thank Honorable Minister of State for Health of Pakistan, and indeed it's extremely important to bring all the different sectors together to address TB. This is also a way for fundraising and for addressing all the determinants of tuberculosis. We are now pleased to turn to Congo in the African region. We are very pleased to have the address of the Honorable Minister, Professor Jean-Rosard Ibarra, Minister of Health and Population, Congo.
Mesdames et messieurs, au Congo, la tuberculose demeure un véritable problème de santé publique. La situation épidémiologique est caractérisée par une incidence de 368 cas pour 100 000 habitants, une mortalité chez les patients tuberculeux à bactériologie négative de 45 cas pour 100 000 habitants et à 38 cas pour les patients tuberculeux à bactériologie positive. Une proportion des enfants parmi les nouveaux cas et rechute de tuberculose faible dans l'intervalle de 5 à 15%. Tous les départements sont touchés, avec un nombre de cas plus élevé dans les grandes villes. Face à cette situation, notre pays met en œuvre une série de mesures visant à prévenir et prendre en charge correctement les cas. Ainsi, le Congo a élaboré son plan stratégique national de lutte contre la tuberculose 2023-2027 qui s'inscrit dans les grandes orientations de la stratégie mondiale d'élimination de la tuberculose d'ici 2030. Dans ce cadre, plusieurs interventions et innovations majeures sont mises en œuvre avec l'appui du Fonds mondial et de l'OMS. Parmi ces mesures figurent la mise en œuvre d'une politique de gratuité pour le dépistage et la prise en charge des malades tuberculeux, le renforcement du réseau des laboratoires pour le diagnostic de toutes les formes de tuberculose, y compris l'acquisition d'un laboratoire de type P3. L'application optimale des mesures de traitement des cas et de la chimioprophylaxie chez les sujets contacts conformément aux nouvelles orientations de l'OMS. Le renforcement de la surveillance et de la structuration des interventions communautaires avec l'implication des ONG nationales et du secteur privé. La mise en œuvre des stratégies de mobilisation des ressources domestiques et externes pour renforcer le financement de la lutte contre la tuberculose. Grâce à ces interventions, les résultats suivants ont été obtenus. La notification des cas de tuberculose au niveau national est à 63%. Le taux de succès thérapeutique a progressé, atteignant 82% en 2024. Le taux de succès du traitement de la tuberculose pharmacorésistante est de l'ordre de 81% et de soutien économique et nutritionnel aux patients est permanent. La prise en charge thérapeutique des enfants et des adolescents se fait surtout dans des services intégrés à tous les niveaux de la pyramide sanitaire sur la base des directives nationales. Malgré ces performances observées, quelques défis persistent, notamment l'implication du secteur privé, qui demeure faible, ainsi que la collaboration multisectorielle. La raréfaction des ressources, notamment financières, le recours tardif aux soins en cas de taux prolongé. Face à ces défis, le gouvernement entend mettre en œuvre une série de perspectives visant à améliorer le dépistage précoce des cas, l'élargissement du réseau des laboratoires, la mobilisation des ressources internes, le renforcement de l'intégration de la lutte contre la tuberculose dans les soins de santé primaire. En conclusion, la lutte contre la tuberculose au Congo bénéficie d'une attention particulière de la part du gouvernement à travers les budgets qui sont alloués au programme national de lutte contre la tuberculose, la gratuité complète de la prise en charge, le renforcement de la participation communautaire et une excellente collaboration avec les partenaires techniques et financiers. Oui, nous pouvons mettre fin à la tuberculose au Congo. Je vous remercie.
We thank His Excellency Minister of Health of Congo for his strong commitments and again very concrete measures in place in the country. And in fact, once again, to highlight that there is no other way, neither increase the domestic investments in the TB response and implement measures in line with the latest WHO guidelines, clearly identifying the most vulnerable, the priority groups. And it's great that in Congo, children are under the spotlight. It's extremely important. Now we would like to move to another region, one of the highest TB burden regions, and turn to high burden country, Vietnam. We are pleased to share the address of Honorable Professor Tran Van Tuan, Vice Minister of Health for Vietnam. The country has made many positive strides in the fight against TB, including through engagement of other sectors and through the use of innovations. Let us hear from the Honorable Vice Minister.
Distinguished guests, colleagues, and healthcare workers. Today, we gather to commemorate the World TB Day, a day to dedicate to raising awareness and accelerating efforts to end this disease. I'm honored to represent the health sector of Vietnam and would like to extend my best wishes for health and success to all distinguished guests, colleagues, and health workers, and staff involved in the noble and meaningful work of TB prevention worldwide. Vietnam is one of 30 countries with a highest TB burden in the world. With a population of over 100 million, Vietnam annually detects and treats hundreds of thousands of TB patients, significantly contributing to reducing mortality rate, curbing the spread of the disease, and alleviating the healthcare, economic, and social burden the patient, their family, and society. This achievement is largely due to the tremendous efforts of the health sector, particularly the TB prevention program. The Vietnam TB prevention program has been in operation for over 60 years, experiencing many ups and downs throughout its history. In line with the general development trend of society, the program has transitioned from a lateral hand taxi program to a hand insurance mechanism aiming to ensure financial sustainability and local autonomy in TB prevention. In the context of international fluctuation and Vietnam progress toward becoming a middle-income country, it is forecast that international support will significantly decrease in the coming year to achieve the strategic goal set by the government to end TB by 2035. Vietnam needs to proactively mobilize domestic budget resources from local government, private organizations, and socialized TB prevention efforts. These include behavior change, communication, enhancing international cooperation, optimizing international support resources, fostering innovation, applying advanced technology, new guidelines, new drugs, and vaccine, as well as a successful model. Additionally, it is essential to continue strengthening the grassroots healthcare network and integrate TB treatment services with other local health programs. The government of Vietnam has actively participated and made strong political commitment in two legislation relevant assembly meeting on ending TB, first in 2018 and again in 2023. We continue to uphold these commitments, translating them into action, and are determined to lead Vietnam out of the list of countries with a high TB burden, aiming to end TB in the next decade. To fulfill this commitment, in 2024, the Prime Minister of Vietnam issued an urgent directive to support and promote TB prevention efforts. In the beginning of 2025, the National Steering Committee to end TB was convened, following a long period of personnel and organization change, and has outlined a detailed action plan for 2025, creating a solid foundation for solutions to prevent, control, and eventually end TB in Vietnam. Once again, we call on everyone around the world to support this year World TB Day. Yes, we need to commit, invest, and act. We can end TB. Thank you very much.
Indeed, we are standing next to you with this request. Yes, we can add, and we need to invest in TB response. We acknowledge all the efforts undertaken in Vietnam by government, by TB community, and a special thanks for putting spotlight on broader social protection measures. It's becoming mandatory because still we know almost 50% of TB patients and their families facing catastrophic costs, and this is major barrier to care, and it should be reduced by the government's efforts and beyond. Dear colleagues, we are now pleased to turn to Peru and in the region of Americas. We have address of Honorable Dr. Eric Ricardo Pena Sanchez, Vice Minister of Public Health, Peru.
Distinguidos autoridades, representantes de los países miembros y líderes de la Organización Mundial de la Salud, para mí es un honor alcanzarles el saludo institucional del Ministerio de Salud y del Gobierno peruano en el marco de este importante evento virtual en conmemoración del Día Mundial de la Tuberculosis. La tuberculosis aún es un problema de salud pública a nivel global. El incremento importante de la resistencia a los antimicrobianos que forman parte del arsenal terapéutico contra esta enfermedad y el incremento de poblaciones vulnerables que padecen este problema constituyen una seria amenaza contra la que tenemos que redoblar esfuerzos para lograr éxito en la erradicación de este problema sanitario. El Perú, en los 2 últimos años, ha logrado avances ostensibles e hitos históricos en el marco de la prevención y control de la tuberculosis. En la esfera del diagnóstico, que tiene como fundamental fin cortar la cadena de transmisión con la detección de los pacientes y su tratamiento oportuno, hemos ampliado de manera muy importante la oferta del diagnóstico molecular, que no solamente acorta los tiempos para el diagnóstico preciso de la enfermedad, sino además permite identificar las formas resistentes de la misma con el objetivo de implementar estrategias terapéuticas más pertinentes. Además, estamos echando mano precisamente de la tecnología de punta, como es la utilización de radiología digital con inteligencia artificial, con el objetivo de acelerar el proceso diagnóstico y ponerlo también al alcance de la población en el primer nivel de atención. La ampliación del diagnóstico molecular también se está poniendo en el primer nivel a través de los equipos TrueNat, que son un poco más versátiles de utilizar en el campo. Por el lado del ámbito terapéutico, el gobierno peruano ha marcado un hito en la historia de la lucha contra esta enfermedad al ser uno de los primeros países en incorporar los tratamientos acortados que incluyen tecnologías como el pretomanid, la bedaquilina y otros antimicrobianos que permiten que este tratamiento sea exclusivamente por vía oral y en un periodo muchísimo más breve de 6 meses comparado a las anteriores terapias con las que contábamos. Esto no solamente ha incrementado el éxito terapéutico, que en últimos estudios de cohorte de nuestro país hemos documentado que hemos alcanzado ya el 90% en las formas resistentes de tuberculosis, sino también en la adherencia al mismo, que se refleja evidentemente en el éxito terapéutico. Hemos duplicado prácticamente la adherencia al tratamiento de estas formas resistentes de la tuberculosis. Todo este esfuerzo que el gobierno y nuestro país está haciendo con el firme propósito y evidentemente coadyuvado con capacitación a los profesionales de la salud, la ampliación y permanente asistencia técnica a los territorios de todo el país, constituye un reflejo del compromiso del gobierno peruano para luchar con paso firme para la eliminación de esta enfermedad, y estoy seguro de que este evento constituye una brillante oportunidad para compartir esas experiencias, hermanar a los países que somos parte de la Organización Mundial de la Salud y entablar los nexos de cooperación y coordinación para hacer frente a este problema sanitario de la mejor manera y alcanzando los objetivos que tanto lo merecen nuestra población y nuestros pacientes. Muchas gracias.
And we also, from our side, also thanks Honorable Vice Minister for excellent overview and sharing experiences. We've been in Peru last year and impressed by the dramatic progress done since that time and in multiple fronts in implementation of the latest recommendation. And we hope that if we keep with the same speed and prioritization, there will be significant progress towards ending TB. Appreciate. Dear colleagues, it was highlighted by all the speakers, but that partnerships are critical in the effective TB response. So that's why it's very important to hear from one of the key drivers and partners in many countries and globally, representatives of parliamentarians. We have today with us Her Excellency Gulnara Nurumova, co-chair of the ICA Global Caucus, head of the National Caucus in Kazakhstan and regional representative in the Global Caucus Council, member of Parliament of Kazakhstan. So we would like to hear from honorable parliamentarian about your progress, your efforts and vision on the fight against TB.
Уважаемые коллеги, дорогие друзья и партнеры, как соглава Восточноевропейского, Центральноазиатского глобального кокуса, глава Национального кокуса в Казахстане, и представитель региона в Глобальном совете Кокуса, сегодня мы вновь заявляем, да, мы можем победить туберкулез, но для этого нам нужно не просто верить, нам нужно действовать. Финансирование борьбы с туберкулезом – это необходимость срочных мер. Согласно глобальной стратегии ликвидации туберкулеза, у нас осталось всего 5 лет, чтобы достичь амбициозной цели ликвидации туберкулеза к 2030 году. Однако в связи со сложившейся геополитической ситуацией в мире международное финансирование сокращается, а текущие государственные бюджеты недостаточны даже для поддержания существующих программ. Прямо сейчас идет пополнение глобального фонда, ключевого источника финансирования борьбы с туберкулезом в регионе. Мы, парламентарии, должны добиваться активного участия наших стран в этом процессе. Парламентарии могут адвокатировать национальные взносы в глобальный фонд. Партнеры и доноры работать над привлечением дополнительных ресурсов. Но даже с международной поддержкой внутренние бюджеты должны расти для обеспечения устойчивости, а имеющиеся ресурсы использоваться эффективно и целенаправленно. Если страны не увеличат национальные инвестиции, мы рискуем потерять даже те достижения, которых добились на сегодняшний день. Примером может служить пандемия ковида, и мы должны учиться на этом примере. Ключевые вызовы в регионе. Низкий охват лечением. В ряде стран современные краткосрочные и эффективные схемы лечения являются доступными не для всех пациентов. Слабая межсекторальная координация. Борьба с туберкулезом – это не только работа сектора здравоохранения. Нам нужны совместные усилия сектора здравоохранения и других секторов, таких как социальный сектор, образование, юстиция и труд, финансы, окружающая среда, миграция, гражданское общество, частный сектор и другие. Но есть и успешные примеры в регионе Восточноевропейской и Центральноазиатской регионе. Казахстан демонстрирует прогресс. Эпидемиологическая ситуация улучшается. А в 2023 году на борьбу с туберкулезом, включая лечение, диагностику и профилактические меры, было выделено 41,6 миллиардов тенге. Однако проблема лекарственно устойчивого туберкулеза по-прежнему остается серьезным вызовом для системы общественного здравоохранения. Что же делать дальше? Первое. Обеспечить устойчивое национальное финансирование. Это ответственность каждого правительства. Второе. Расширять партнерство. Нам нужны новые инновационные механизмы, включая гибридные модели финансирования и предоставления медицинских услуг, государственно-частные инициативы, а также интеграцию борьбы с туберкулезом, более широкие программы здравоохранения. Третье. Развивать социальное контактирование. Многие организации гражданского общества, оказывающие в основном помощь наиболее уязвимым и труднодоступным слоям населения, все еще зависят от внешнего финансирования. Сейчас мы находимся на важном этапе. У нас есть возможность объединить и приумножить наши усилия и сделать значительный шаг вперед или столкнуться с риском утраты достигнутого. Правительства должны взять на себя ответственность за устойчивое финансирование борьбы с туберкулезом. Парламентарии не могут решить эти проблемы в одиночку. Здесь нам нужна поддержка партнеров. От международных и технических организаций предоставление данных, экспертизы и технической помощи для бюджетного планирования. От доноров в разработке и гибком финансировании переходных стратегий, чтобы страны могли плавно переходить на национальное финансирование без потери качества услуг. От гражданского общества в адвокации за прозрачные бюджетные процессы и контроль за их исполнением. Как соглава Восточноевропейского, Центральноазиатского глобального кокуса, глава Национального кокуса в Казахстане и представитель региона в Глобальном совете кокуса, я призываю всех действовать сейчас. Туберкулез можно победить, но только если мы объединим усилия и не будем терять времени. Спасибо.
We thank our honorable parliamentarian for her deep dive into the problem and highlighting clear roles and responsibilities for different sectors, and also reminding us that there is only 5 years to reach our 2030 NTB targets, and we should intensify our efforts. Appreciate a lot your vision and your leadership in the region. Colleagues, we are close to the end of this panel, this session, and at the end I would like with great pleasure to give floor to our colleague from the regional office for the Eastern Mediterranean region, the regional director, Dr. Hanna Balkny, who is also passionate leader and advocate for the fight against TB, for the universal health coverage, for addressing antimicrobial resistance and broader health, global health issues. You see clearly that it's priority for World Health Organization, and in different regions facing different challenges that we are trying to find way to support countries. Floor is with Dr. Hanna Balkny.
Tuberculosis remains a major public health challenge in the Eastern Mediterranean region, particularly in low and mid-income countries. In 2023 alone, the region recorded 936,000 new TB cases and nearly 86,000 deaths. Every 34 seconds, someone falls ill with tuberculosis, and every 6 minutes, another life is lost. These deaths are avoidable because TB is a curable disease. In our region, treatment programs have a success rate of over 90%, but 3 out of 10 cases remain undetected and untreated. Less than half of new patients use rapid molecular tests that can detect resistance to antibiotics, and preventive treatment remains rare. All of this fuels transmission and impedes tuberculosis control. On World Tuberculosis Day, I urge member states to take decisive action. First, strengthen political commitment and leadership to NTB through robust national strategies. Second, increase domestic funding and international collaboration for TB control programs. And third, deliver. Scale up WHO recommended interventions, including early detection, diagnosis, preventive treatment, and high quality care. Act now, invest now, deliver now. Because together, yes, we can end TB.
We thank Dr. Hanna Balkny, and I would like once again to acknowledge the tireless efforts of all our eminent speakers and their respected government, countries, and communities to address TB. You see not only only strong commitments, but also very concrete actions and how they're driving the progress towards ending TB. This really inspires. For the next session, I now hand over to Monica Diaz, cross-cutting lead at the WHO Global TB Program, focusing on multi-sectoral engagement and accountability.
Thanks so much, Teresa. Dear colleagues, you heard earlier from our Director General, you've heard from ministers, other distinguished leaders, from John Green, from our civil society task force, about the challenges of fast-tracking the TB response in the face of severe resource shortfalls. One of the solutions to combating growing resource constraints, WHO, as one of the solutions, WHO is driving the integration of TB and lung health within primary healthcare as a sustainable solution. Today, we at WHO are launching a special policy brief to provide guidance on the integrated approach to TB and lung health. I would like to invite my colleague, Dr. Lise Gonzalez Angulo, Technical Officer in the Prevention, Diagnosis, Treatment, Care and Innovation Unit in WHO's Global Program on TB and Lung Health, to take the floor and present the brief. Over to you, Lise.
Thank you very much, Monica, and many thanks to our colleagues here and to everyone who is joining us online. Today, we continue to recognize the urgent need to accelerate our efforts to end TB, and I'm excited to introduce a few highlights from our new policy brief on an integrated approach to TB and to lung health. This policy brief outlines key priorities and strategic actions to implement an integrated people-centered approach as a tool to improve service delivery and to bring us closer to our targets to end TB. And we begin with a stark reality. Many of you may be familiar with the figures that you see on the screen right now. Lung diseases are among the top 10 causes of death worldwide, with TB, pneumonia, chronic obstructive pulmonary disease, lung cancer, asthma, and other respiratory diseases accounting for nearly 10 million deaths each year. As we continue our efforts to end TB, we must recognize the intersections with broader lung health challenges while we optimize resource allocation and create efficiencies across our health systems. An integrated people-centered approach, one that addresses shared risk factors, that prioritizes prevention, and that ensures a continuum of care from diagnosis to treatment and that goes beyond treatment, has never been more urgent. We know that TB risk does not exist in a vacuum, and as this slide illustrates, there are multiple overlapping layers of risk for TB and for lung diseases, from socioeconomic factors such as undernutrition and overcrowding to biological, behavioral, and environmental exposures. These factors do not act in isolation. They compound each other, and they intensify the vulnerabilities in individuals and communities. TB and chronic lung diseases frequently intersect, either because some of these conditions serve as risk factors for TB, they share proximal risks such as smoking, or they may coexist independently. We also know that TB in itself can cause lasting structural lung damage, and while the lung function tends to improve after TB treatment, many patients still face incomplete recovery, which can be observed after many years after patients are being discharged from treatment. And that is reflected in the growing body of evidence that we see today on post-TB lung disease. When we failed to intervene early, we allowed individuals to suffer the long-term effects of TB, and we place a lifelong burden on them and their families. These challenges and these intersections highlight the critical need for integrated care pathways. This policy brief is the result of a collaborative effort with several countries and very key stakeholders. It builds on the earlier experiences and implementation of the practical approach to lung health. It highlights considerations for addressing these intersections across various points in the cascade of care. And it outlines key opportunities for creating impact as we tackle the dual burden of TB and chronic lung diseases. These include opportunities for early detection and treatment, ensuring that once an individual presents with respiratory symptoms, that the system is not going to let go of them. Such an approach also promotes economic and operational efficiency, maximizing resources, and more importantly, leveraging existing infrastructures to optimize service delivery. The approach is also intended to ensure equitable service delivery by bridging the gaps that are caused by multiple determinants of health. With early detection, diagnosis, and with proper treatment, this approach would help us limit also the development and transmission of drug-resistant infections. Another key aspect, and very important, is that an integrated approach to TB and to lung health would also contribute to strengthening preparedness and strengthening the ability for health systems and for countries to respond to emerging threats, in particular those of respiratory nature. Our objective is clear, as we've heard from each one of the speakers earlier today. We must address the interconnected challenges of TB and lung health through an integrated people-centered approach that leaves no one behind. And achieving this requires strategic actions. I won't go into detail on each one of these actions, but to conclude, I would like to highlight a few points. We need political will and commitment to prioritize an integrated people-centered care agenda. We need to prioritize TB alongside all efforts to improve lung health. We need to scale up investments in prevention, diagnosis, and treatment, as well as investments in primary care referral networks, surveillance, monitoring. And a crucial need is also to invest in our workforce. We must ensure that the integrated care models are implemented effectively and equitably. And to do so, all efforts must be coordinated with key stakeholders across programs. We need cross-programmatic action, and we need a robust multi-sectoral response, including engagements of communities. And with that, I would like to thank you all for your attention, and I would like to invite you to visit our website for additional resources on integrated care. And yeah, thank you very much. Over to you, Monica.
Thank you so much, Lise, for that comprehensive but very quick overview. We will post in the chat the links to the document, and you would have seen it in our news flash as well. So now, colleagues, before I hand back to Dr. Teresa Kasaiva, we would like to invite you to do an exercise with us while we are in parallel with the next session. We would like to invite you to go again back on Slido, where you entered your name. So again, you can join on www.slido.com, and the passcode is #WTBD2025. And we have a new poll now that's opened, and we would like to share with you, time permitting, if we can do the interactive session, we would like to hear what your top recommendation or proposal to fast track the TB response in this current financial crisis would be. So please do log in. This is going to run in parallel while we do our next session. Please do post this. And for those who would like, those who have questions, please do use Zoom for your Q&A. Thank you very much. I now turn back to Dr. Teresa Kasaiva.
So thank you very much, dear colleagues. With this, we are moving to our strategic leadership roundtable. We hope to have a very interactive exchange, discussion with our key partners. The strategic leadership roundtable, according to its name, convenes change makers, leading partners for a powerful dialogue on securing and scaling up financing and investments to NTB, despite of the current challenges, funding shortfalls, through a new way of thinking, through doing business different way, not as usual, through strategic collaborative, and let's try to find some maybe new ideas, new solutions, even during this relatively brief session. And I would like to give floor first to Dr. Yogan Pillay, Director of HIV and TB Delivery from Gates Foundation, and our long-standing partner, recognized expert, working closely with WHO, and of course trying to address key gaps along TB care, including through rollout of innovations, new tools, game changers, supporting national programs to develop the comprehensive and very concrete plans, and as well as pushing forward R&D agendas general, including for new TB vaccine. Yogan, please share with us what role is the Gates Foundation playing in the leveraging financing, in addressing TB epidemics, and in general, what are priority, and how we can strengthen TB response, maximize the impact of current tools. Yogan, please.
Great, Teresa, thanks very much, and thanks for the invitation, and I'll try to be brief. The foundation does two things. One is research and development, and we fund a significant amount of new tool development. At the moment, as I think many people know, we are investing in TB vaccines, and we are quite excited about M72 and its potential to decrease new infections. As as long as, of course, we have it, we can afford it, and we can make it available to countries, especially the high burden countries. The second is, of course, to improve diagnostics and to have nucleic acid diagnostics, the NATs, as first-line diagnostics and at low cost. And the foundation is working with a number of partners to try and decrease the cost of these NATs. The third, of course, is to decrease the duration of action of these therapeutics. So we have pan-TB regimens in development, and we are hoping in the next few years to get a 2-month oral and potentially a 2-month injectable for both drug-sensitive and drug-resistant TB. We also need to ensure that the existing tools are maximized. And we are quite worried about the amount of TB that's undiagnosed in communities, both symptomatic and asymptomatic. So one of our strategic goals is to increase and improve the ability of countries that we're working in to do active case finding, both in facilities as well as in communities. I was quite amused to hear Hans talk about Europe trying to move treatment of TB from hospitals into primary healthcare. I think Europe has a lot to learn from Africa, where we've been doing TB in primary healthcare clinics for the longest time. So some lessons for Europe from Africa on primary healthcare and the use of primary healthcare channels to deliver TB services. We also need to, optimize the way in which we deliver services. And I think the integration that our colleague from WHO just spoke about is one example, but we need to figure out not only the what with integration, but the how. And I think, we need to have a few more models on the how of integration of TB into primary healthcare. I know everybody thinks it holds significant promise. We have the same promise with integrating HIV into primary healthcare, but the how has been eluding us in many contexts. So to the extent we have good case examples of the how, and we can help countries scale that up, would be very useful. In terms of sources of funding, clearly we need to improve domestic resources. And I think the middle-income countries, which are also high-burden countries, have shown us that this is possible, and clearly they need to do more, not only on the delivery side, but also investing in research, because we lost a significant amount of research funding as well in the last few months. And the second is around optimizing the delivery platforms and coming up with new models of delivering TB services. I fully agree as well that we need to take services into communities. Expecting communities to come into care in our facilities only will solve part of our challenges and won't solve others. And we need to get employers on board. Many people are still in formal employment, and we need to encourage employers to do routine tests for and of their employees, and also put them on treatment. So there are many things we need to do. There are many things we have to do. In the foundation, we've basically, in our new strategy, prioritized new tools and getting these new tools PQ'd where needed, registered by regulatory authorities in countries as quickly as possible, and introduced as rapidly as possible. And we think that the diagnostics could lead the way while we wait for the vaccines and therapeutics. Modeling has been proven to be quite useful, and we are certainly moving to figure out what combination of interventions in which spaces would be useful. And then finally, Teresa, modeling is also going to be useful to know where the force of infection is the highest. With decreased funding and decreased resources all around, we can't, have one-size-fits-all policies and strategies. We've got to know where the force of infection is highest and start there with our interventions and tailor the interventions with communities, with people living with HIV and TB in countries which have high co-infection levels, as well as with the people living with TB in those communities. I'll stop there. Thank you very much for the opportunity.
Jürgen, thank you very much. In your brief but extremely smart speech, you've managed to bring all the key game changers and I would say accelerators of the progress that should be prioritized and in place. And we thank Gates Foundation and you personally for strong commitment, support and leadership. So definitely these all should be discussed further and new ways of working should be brought in the current circumstances. Now I see already on screen our other good friend and partner. Global Fund was acknowledged by many speakers today during this talk show as one of the key important the biggest international donors, and we can continue. All this is true, but Global Fund also facing some challenges in the current circumstances, as we all. And it would be great to hear from Michael Beer, the head of technical advice and partnerships of the Global Fund. How is the Global Fund driving impact to bridge critical funding gaps and help restore the TB services in low-income countries on the road to ensure universal and timely access to care?
Dr. Teresa, friends, partners, good afternoon, and thank you for bringing us together. You are all part of the Global Fund partnership, a partnership that in 20 years has saved 65 million lives and reduced death rates from HIV, TB, and malaria by 63%. And on TB, we have made, as you've heard, absolutely tremendous progress and fantastic momentum, with the highest number of cases found diagnosed officially in 2023, and I expect the 2024 figure will be higher than that. But our collective concern could be just how fragile this success and this momentum really is. When we look in terms in the face of more restrictive overseas development assistance, we look in terms of rising conflict, numbers living in poverty, climate change, and a danger that because of the success that we've achieved so painfully against TB, that in some ways it's going to take care of itself, can lead to a complacency that can really set our progress behind. So it's a really important moment, a crossroads from the partnership in terms of where we go from here. The Global Fund is about 75% of all international financing against TB, but that's a small portion of the overall financing, because most of the funds, and rightly so, do come from the countries themselves. And the Global Fund's replenishment this year will help. And we have an investment case for the three diseases. And it's maybe echoing a bit what Jorgen was saying, the investment case in TB is very strong. And I think, again, for our partnership to echo that investment case, because we do know the what, and we're getting better on the how, on how to win against TB. And there is terrific returns for countries and for donors investing in TB. We've seen over the last period innovations in TB service delivery, earlier and quicker diagnosis and treatment of TB, more decentralization from hospitals to facilities to communities, more partnerships with the private sector and greater engagement with the communities. And also a stronger learning across countries in terms of some of sharing and spreading those best practices faster. And I think linked to that, and this I think is a response by TB actors in response to how COVID set TB back, was the opportunities of greater integration on TB with lung health across service delivery and across health functions. And also recognizing that TB is the driver for pandemic preparedness for all respiratory diseases. And that's something we did see and learn in COVID. It's also a key driver of antimicrobial resistance. Also, another lever, and what's important, is the continuing work that we do in terms of innovations on health products and tools. We've talked about the vaccine, and Jorgen talked about some of the NATs, the near point of care diagnosis. When we look in terms of our investments in TB and where we can drive cost efficiency and effectiveness, how we can reach more people with potentially less money, how we can lower the cost of finding and diagnosing with molecular diagnosis, the WHO recommendation, how we can do that more cost effectively with new tools and products is really essential to reach more people and to cure them. I think we're also seeing that TB prevention is getting more attention. And another lever is really the necessary focus we need to continue to bring to tackle the barriers to fear, stigma, and discrimination that often restrict the most vulnerable and the poorest from reaching TB services and cures at the earliest possible time. And we need to continue our work too on advocacy and working with countries and their leadership, both in government and in civil society, to increase the political will so that we can sustain the momentum. We know the what, we can work on the how, and we can advance on TB very cost effectively. A strong global fund replenishment this year will also help, but it's really how we work with countries to put that what and how in place with innovations and new products that will really help us reduce deaths by 50% between now and 2030. Thank you.
Thank you very much, Michael, for excellent collaboration and tireless efforts. We are all very much looking for the successful replenishment, and from our side also WHO commit to do the best for the success of this replenishment. Your support, especially to the low-income countries, is absolutely essential and vital. So let's continue working together. The colleagues, despite of some chronic and critical gaps in access to the life-saving services, just to remind you that we have only 26% of the funds available, and against our target set at the political declaration, and of course it's not sufficient at all even to cover essential needs. But we must not neglect research and innovations, because they're drivers, they're game changers, and we cannot wait until the better time. And here we have today with us our another great partner and friend, Dr. Philippe Duneton, Executive Director of UNITAID. And thank you, Philippe, for joining us, for a strong and collaboration for many years and commitments. So, Philippe, please share with us what steps is UNITAID taking to advance further research and innovations to combat TB, drive it market shaping, expanding access, and accelerating the uptake of the breakthrough tools in the face of the current financial crisis.
Thank you, dear Teresa, and Honorable Minister, dear colleagues. Thank you for your invitation, and for sure we are part of the partnership, the strong partnership that we have been part with you, Teresa, the Global Fund, Gates Foundation, Stop TB, and countries, of course, all around the world. I would start to say that fighting TB needs a long-term vision and commitment. We know that it's a bumpy road, especially nowadays, and not only at TB, but we know that TB is still a major public health killers, in particular in low-income countries. Of course, you know the figures, and I just want to say that the crisis that we are facing, which is a crisis about delivery, finding cases. I think number of participants have flagged that, is really has the potential to really have a big impact in the fight of tuberculosis, with what we have seen, in fact, also during the COVID time, in terms of increasing the risk of transmission and number of cases, increasing the number of deaths, but also increasing the resistance. And this is something that we need to have in mind. And it's really something that, again, partnership with country has to tackle. I just want also to highlight what was said by the colleagues at the Global Fund, but also by Yogan, and I'm sure other participants have heard. I think that the global response, as we have, even with the limitation we have seen over the last decade, first is a lot of progress But and due to the innovation, and this is something that we need to have in mind, and for now and the future, but also raise the question about how this response needs to change. And it's not specific only for the TB, but I think there are 3 or 4 keywords I want to highlight without detail, but I think that we need to all together with countries, with Minister of Health, look at several things. First, I think that the program should be, and I think there are many good examples in TB already, to be co-construct with countries in a way that we need to make sure that we can really make the difference. And co-construct means to think about efficiencies. Efficiencies will come from innovation, from tools in the hand of health workers or even sometimes people directly to drive the costs down. But again, the service delivery, and I think Jürgen mentioned the point and the difference between Europe and Africa, where in Africa already we know and we will support and continue to support the community-based approach, in particular to access to drugs and even for MDR-TB that we want to do with countries and stop TB. So thinking about efficiencies on a systematic manner, maybe more systematic than we have done before, is key. Integration also is key. I was mentioning the very important role that the TB community has done during the COVID-19, and I think that this change has also been reflected in the new title and mission of the department, which is not only tuberculosis, but lung and, of course, airborne transmission. I think it's a good move, and we need integration if we want to be more efficient and also more capable to reach poor people in the communities and of course people who need us and need access to care. And of course the question of money, we cannot of course undermine the need for countries also to think about how domestic money with international money, and we need to have a fully funded global fund and support to WHO, of course. And these are the 3 things with co-construction that will make a difference. And yes, we have new tool and we are expecting more. I was mentioning, of course, in test, I think that there are, since even with the new tools we have, we made a big progress in detecting new case of tuberculosis. We hope and we will invest in more easy to use tools, we hope, in the coming years, but also some kind of challenging but very efficient tools for looking at MDR-TB using genomics, which is already ongoing. So there are, I think, in TB, a key element in TB detection test, including the progress that needs to be scaled up for the children, of course, as you know, which is innovation that we have been funding and still is a challenge in many places. We have now, and I think it's important to mention, and we have invested a lot in the prevention, the therapeutic prevention of tuberculosis that works. Of course, we are looking and we are part of the coalition in terms of vaccine. We hope to see vaccine. It's important to figure out and to think upfront, like in the therapeutic coalition that is led by WHO. We need also to think about the characteristic. There are different types of vaccine that can potentially come to the market. This will be a game changer, but the way, of course, in terms of how this will be used according to the characteristic and the fiscal space will be key if we want to progress on that, something that, of course, is close to our heart. but also more to come in terms of TB-resistant TB. We know we have the treatment. Now we have all the evidence, and it's also the work of the coalition, not only UNITED, but also WHO and Global TB Alliance, of course. And this need to be a very proactive implementation, again, mentioning also the community-based intervention that can play a big role, we think, in terms of access also to treatment. So yes, times are difficult. There are many trade-offs that at international but also domestic level are to come. We believe strongly that if we don't push hard on testing and treating TB, we will see a dramatic situation. So again, the progress that we have seen and invested in over the last decade is at risk. We can have real progress, but it's fragile, as said by our colleagues on the Global Fund. So this has to be clear. Outside the community of TB knows very well the challenges, but we need to share this challenge and trade-off in the coming weeks and months. Thank you, Teresa. Over to you.
Thank you very much, Philippe, for sharing with us your vision on the priority areas on which we should be jointly focused. Can't agree more with all your points. And once again, thank you for a great job. UNITED is real accelerator driver of all the innovations, and due to your work, many countries managed to uptake. We've managed to reduce by joint efforts of you and all the partners, reduce the price for the best tools for the diagnostics and treatment. So let's continue moving this direction. That is the way, definitely. And now I would like to turn to our big partner, the Stop TB Partnership, and its representative today, the Deputy Executive Director, Dr. Sahu Suvanand. And thank you, Sahu, for joining us today. And you've heard clearly from almost all the speakers about the vital role of communities, and that they are drivers, even in situation of crisis, the disruptions, they're continuing doing their job, not for profit, but because of their idea, passion, and dedication. So again, what is your thinking about innovations in this area? How to continue mobilizing communities and civil society to drive advocacy, to close resource gaps, to ensure stronger people-centered, community-led response? Sahu.
Thank you, Teresa. Dear colleagues and partners, I bring greetings from the Stop TB Partnership. I start with the World TB Day theme, Yes, We Can End TB, Commit, Invest, Deliver. It is a call to action to end TB, the world's deadliest infectious disease. I will briefly focus on what Teresa was asking about, two of the important things we need to end TB, communities and funding. There is a huge funding gap in TB care and prevention, as we know. The 2023 UN high-level meeting committed to mobilize $22 billion per year, but the currently available funding is just less than $6 billion per annum. So huge gap there that hampers our ability to provide prevention, diagnosis, and treatment services. Out of the available funding, there was a part which was from external donor sources, and we saw during the last few weeks how dependent it was on one country as donor. Recent events, recent reductions in international aid have disrupted TB's programs, threatening to reverse years of progress and potentially leading to more drug-resistant TB variants. From Stop TB Partnership, we have been highlighting these disruptions. In this challenging landscape, the role of civil society and affected communities is indispensable. They are the frontline warriors, advocating for scale-up, advocating for increased financing, monitoring the accessibility of services, calling for accountability, and amplifying the voices of TB survivors, and ensuring that vulnerable populations receive the attention and care that they deserve. In the last few years, the Stop TB partnership has played an important role in creating a momentum led by TB-affected communities. The bad news is that at this moment of external donor funding cuts, the most at risk of getting defunded is the area of work of communities. We all know that no disease has ended without a critical role of communities. Take smallpox or polio, or for that matter, any other infectious disease on their way out. Community had a big role. We must increase funding for the entire TB response, and especially for affected communities. In this context, I would like to make 3 points. First, as many said, we have to increase the domestic funding for TB. Heads of governments, ministers of health, ministers of finance, members of parliament, all have a role in this. Recently, we saw positive news coming from Nigeria on increased domestic funding. I think the figure was something like 700 billion nairas additional committed by the parliament and the minister of health there. We have seen such increases also in other countries in the past, in Indonesia, in India. It is possible. The multilateral development banks will now have an important role here by providing subsidized loans or repurposing existing loans in some countries. And we have also seen in the past loan buy-downs with the involvement of Global Fund. Now it is time for more countries to consider such development bank financing, as well as increasing the domestic funding using this financing. Second, very important is we must focus on diversifying the resources or diversifying the funding sources for TB. Not just domestic budget, but different things can be done at the domestic level, and also external funding and innovative financing. Such sources could be coverage under the health insurance, impact or result-based financing schemes that are existing today, private sector funding, introduction of sin tax on tobacco, alcohol, that are then used to fund health services or TB services, converting sovereign debts into health outcomes by debt swaps. So these are some of the innovative mechanisms that could be put in place. In December 2024, in the Stop TB board meeting in Abuja, we had an excellent session on this topic, led by some amazing inputs from the Honorable Ministers of Health of Indonesia, Nigeria, Philippines, and South Africa. If some of you were in that meeting, you would completely agree with me about how amazing this was. From Stop TB Partnership, we will continue to follow up on this. Third, within the available funding, we need to do things in a more innovative and efficient manner using new technology and AI, and shifting some of the TB costs to what I call as non-TB budget lines. I think Jorgen also referred to this in his talk. There are many things that can be done in TB screening, testing, treatment, care pathways, where we can deliver more impact by using innovative approaches, such as multi-disease screening, shifting some of the TB screening costs into other health programs and having a more efficient screening for multiple diseases. Employer-initiated screening, I think Jorgen referred to this. Employers, if they do it, this budget line can be, a part of the budget line can be offloaded to the employers of people in countries. AI predicted hotspots for prioritizing program actions. AI reading of X-rays, specimen pooling, telemedicine, e-learning, strategic purchasing of services from the private sector, and things such as using a One Impact digital tool for networking the communities to be more impactful. Stop TB Partnership's TB Reach initiative has worked on some of these innovations, and we will continue to pursue on this. So 3 things here: domestic funding, diversified funding, and innovative approaches. And we need to invest in communities. And thank you, Philip, for investing in communities in the UNITAID new project on drug-resistant TB. Finally, the path to ending TB is not easy, but yes, we can end TB if we together commit, invest, and deliver. Thank you, Teresa.
Thank you very much, Saho. It's really impressive to see that despite of the current challenges, Stop TB is continuing and even stronger with the advocacy, with the community engagement efforts. And across the whole session, we see, despite of the challenges, people are not mentioning that much about challenges, but more focused on the opportunities, are really actions oriented. This is exactly amazing and inspiring. We should continue moving forward with this vision and attitude. Thank you, Saho, very much. Now, I would like, with a special pleasure, give floor to our good friend and guest today, who is here today with us in person, Dr. Poonam Thavan, Director, Migration Health Division, International Organization for Migration. Again, it was recognized by multiple participants that TB is multi-sectoral problem, and there are groups of people who are becoming, in the current circumstances where we have increased number of conflict, climate, health related issues, more vulnerable, and migrants are definitely among these the most vulnerable people. Poonam, could you please highlight the IOM's role in addressing the intersection of TB and migration, and how shifting global dynamics and current resource challenges are impacting efforts to combat TB, particularly among migrants populations, and why it's important to prioritize their needs? Please.
Thank you, Teresa, WHO colleagues, and also the partners coming together today for World TB Day. I'll try to continue on in the spirit, as you said, Teresa, that Sahu and also other speakers in this roundtable presented, in terms of even more so now having an action-oriented approach and trying to identify solutions for the way forward. To answer your questions, of course, as most of us who work in public health, in TB, well know, TB is closely interconnected with migration, given the complexities of global health and human mobility. Various socio-economic as well as legal, cultural, and access-related factors implicate and lead to sometimes a greater risk of TB burden. And we see this in our experience across various countries. So you had interventions from ministerial participants from low incidence countries, but also high TB burden countries. And really, it's important to look at the intersection of TB and migration from that roots-based or almost pathways approach, where we find those barriers leading to a higher burden. In addition, of course, there are various other global migration as well as health-related trends, whether it's the high burden of antimicrobial resistance, especially amongst vulnerable communities, hard-to-reach populations, whether it's increasing disasters or conflict-related displacement that leads to this divide, if you will, between access to health services, including TB, but primary healthcare in general, and certain populations. And lastly, at the policy level, regretfully, we continue to see challenges in terms of including migrants as well as vulnerable host communities, for example, hard-to-reach groups in cross-border areas, being absent in national strategic plans for TB. And often this translates into an even greater challenge for organizations like IOM, but also most importantly for NTPs, for local health partners, both in the public and private sector, to include these communities in the interventions. I won't go into much details in the interest of time in how working closely with NTPs, WHO, and also our partners, including the Global Fund, including GDF at the Stop TB Partnership, the World Bank, and others. We are making significant progress in some areas in terms of building community-based interventions or providing access in conflict-affected areas, whether it's in the Middle East region or looking at cross-border TB work in the greater Mekong sub-region, as well as when we work together with governments in providing systematic screening, be it for active TB or latent TB, as individuals around the world undertake various migration pathways, asylum seekers, as mentioned by the Honorable Minister from Germany, but also other migrants around the world. What I'd like to take a little time on now is to focus a bit more on the how in terms of the future directions that we would recommend, also given the theme of this World TB Day in terms of committing, investing, and of course, at the end of the day, delivering in terms of those investments. Firstly, it's very important that we continue to strengthen partnerships with WHO, and we take note of your own efforts to integrate further. So the global program on TB and lung health, integrating TB within primary healthcare, and how we can make sure that migration-related issues can be part of these integrated health approaches. Secondly, working across sectors is critical if we are to ensure that the TB burden amongst migration-affected communities is reduced and we inch closer to the end TB targets in these areas. And this means that solutions will often lay outside the health sector alone. We need to get comfortable working with migration authorities, working with labor ministries, and of course, working whole of society, as some of the civil society related interventions have mentioned today. Thirdly, and Sahu touched upon this, when it comes to working on migration, community-led prioritization becomes important. Often in hard-to-reach areas, we find that those who live those experiences are often best placed to advise health systems approaches. So it would be important to engage in stronger community-led actions for migrant communities. Fourthly, the work with partnerships, and here I'd like to refer to the private sector engagement. In many parts of the world, healthcare still is highly subject to the private sector delivering it. And when we speak about improving access for migrants to TB-related prevention, detection, treatment, and care, we need to also find ways to work better with the private sector, also at the local level, to reach these communities where they live. And on the other hand, we need to work better in terms of operationalizing the innovations that the global health community is working on with the private sector, whether it's in terms of AI-led radiology or whether it's in terms of shorter treatments and better access to diagnostics. How do we bring these to hard-to-reach populations and ensure that there can be access for all? In light of the many challenges that have been mentioned here today, lastly, from IOM, we would also like to remind us all that there is as well a certain merit in harnessing the positive potential of migration. There are communities out there, including strong diaspora, that can work with us both in receiving countries and sending countries to advance universal health coverage. And that, of course, includes working on TB. Health workforce, the migrants that we see amongst the health workforce and health systems around the world can also be a key operational partner in terms of advancing the work on TB and migration. So I'll stop there, Teresa, and thank you again for bringing IOM into this discussion. And we, especially in these times, look forward to strengthening our engagement and collaboration with WHO and NTPs and others. Thank you.
Indeed, Poonam, thank you very much to you, to your excellent team, and to the whole organization for excellent collaboration that we are strengthening from year to year. And last year we launched and together developed the first ever report on TB and migration that was presented at the WISH Forum with very concrete actions that we hope that will be followed by including by investments as well. And when we're talking about problem of missing people in TB, migrants are truly missing people and the most vulnerable, and sometimes they're in between our efforts and not properly addressed. It's time to recognize their needs and to address together. And you summarized in very comprehensive methods way the measures that should be in place as soon as possible. Thank you. Thank you very much. It was an excellent final speech in our interactive panel with our key partners, friends and colleagues. We're almost close to the end of this talk show. And I would like to hand over to Monica Diaz, my colleague, she will manage the Q&A session.
Thanks so much for that, Teresa, and for all of the panelists. We are now at the interactive session. We've had a few Q&As asked on Zoom that have been responded to online. But what we're really pleased about is many thanks to all of you who logged into Slido. We did ask you a question actually, and we were looking forward to your answers on what is your one top recommendation, what is your proposal that should be a priority according to you to fast track the TB response, especially in these resource constrained times. So looking at the responses, we have a whole range of responses, some very long, some very pointed. For instance, we have Maqsood Bangash from Pakistan, who's made a whole range of suggestions from diversifying funding resources, leveraging technologies, public-private partnerships, all of these results-based financing, and improving efficiencies. Others, more anonymous, have proposed leveraging the use of artificial intelligence. We have Moyuddin from IOM, perhaps at the country level, further down, talking about prioritizing non-traditional donors like private sector, pharma, and also again this call for optimization of what limited resources we have. There are others who have asked for the engagement of community and civil society to bolster the response. And again, a repeated suggestion throughout is on enhancing domestic investments throughout, because this is what is going to be really sustainable, all through to the end, for countries to take ownership of the TB response to fast track and move forward. So dear colleagues, please do keep your suggestions, your proposals, your recommendations to WHO coming in. We will collate these and use it moving ahead. So thank you very much. Back to you, Teresa.
So thank you very much. We are continuing receiving your questions. We will try to respond if you will post your email, and we are in touch with you. We'll be happy to continue our fruitful conversation. And we are almost close to our session, and with extreme pleasure, I would like now to invite Dr. Jerome Solomon, Assistant Director General for Universal Health Coverage, Communicable and Non-Communicable Division, where Global TB Program is housed under, and he himself is a champion in NTB efforts and advocate, and using every platform and stakeholder discussions to advocate for TB, to bring attention. You can follow him in social media, especially the last months, a lot of advocacy and important communication. Dr. Jerome, please, floor is yours.
Thank you, dear Teresa. Distinguished participants, dear colleagues, partners, and friends, today's high-level discussions on tuberculosis have been impactful and action-oriented, strengthening our collective determination to revitalize and accelerate the tuberculosis response, even in the face of formidable challenges and limited resources. As you heard, tuberculosis remains a relentless killer, claiming millions of lives and inflicting immense suffering on individuals and families. Recent funding cuts have only deepened the crisis. Today, governments, partners, and civil society have shown that commitments made at the United Nations high-level meetings can be achieved with groundbreaking innovations and continuous collaboration. The urgent need to leave no one behind, especially migrants and refugees, has been forcefully emphasized. The World Health Organization has released a special policy brief on driving the integration of tuberculosis and lung health within primary healthcare to ensure a comprehensive, people-centered approach. We must escalate our efforts to ensure that every person with TB has access to high-quality prevention and care, reinforcing WHO's commitment to universal health coverage. I would like to remind you of WHO's top calls for action this year as I close. First, we must strengthen commitment and action to urgently revitalize and accelerate the TB response despite the challenges we face. Second, work towards ensuring universal access so that all people affected by TB, especially vulnerable populations like migrants and refugees, receive high-quality prevention, treatment, and care. Third, drive innovation and progress, leveraging new technologies, research, and country-led initiatives to achieve the United Nations high-level meeting targets. Fourth, prioritize equity and inclusion to ensure no one is left behind in the fight against TB, particularly as global conflicts and humanitarian crises intensify. Fifth, mobilize resources and collaboration across sectors beyond health among governments, civil society, and global partners to combat TB effectively. At WHO, we pledge unwavering leadership in the fight to end TB, and we are working with our partners to reach the millions affected each year, considering the challenges, hardships, or crises we face. Our commitment must not wither until every person, every family, and every community impacted by this deadly disease is reached, protected, and saved. I extend my deepest gratitude to our distinguished speakers, panelists, and to you, our dedicated participants, for keeping the fight against TB at the forefront. Now is the time for action. We must honor our commitments with urgency. There is no time to waste. Let us unite, prioritize, and invest in the battle against one of the world's deadliest infectious diseases. Together, we have the power. Yes, we can end TB, thanks to you.
Thank you, everyone.